This is Dr. Richie Cole. This information that I'm putting out today is really directed towards a particular place that I work, but I want to I'm not going to name the place because I also want it to have general utility where applicable and when applicable. And so the place that I work is a community behavioral health treatment facility where the therapists are pre-licensed. And that means they're either practicum student therapist trainees or registered associate professional clinical counselors or registered associate marriage and family therapists. So they're all pre-licensed. The place has a front desk that deals with administrative issues, and then the therapists have clinical supervisors, me being one of them, and then there's the program director. If this information, if any part of it's not applicable to you, when in doubt, communicate with your clinical supervisor, or if it seems more appropriate having to do with the agency in general, you'll want to communicate with the program director. And so the main issue being addressed is when clients are mandated to treatment. At a private practice or a community behavioral health treatment facility, all sorts of people call in for all sorts of different problems. Could be families, could be couples, could be adolescents, could be children. They could need classes. And so every place is different. And I just want to make sure that I'm not leading anybody in the wrong direction. So like I said, your place might have a different protocol. But in general, when people are mandated to treatment, it's either through the criminal courts, sometimes the civil court, but more oftentimes than not, the Department of Children and Family Services or the family court. And then there's clients that come with a pending case where the case has not yet been adjudicated. And in fact, they might not even have an arraignment, but they have an attorney, and their attorney suggested that they get treatment started because it'll look favorable for them in the adjudication of their case. So there's places that do anger management. Usually that's 26 sessions, but the family courts or the Department of Children and Family Services can make any determination. It doesn't have to be 26 sessions. Batterers treatment, or sometimes known as domestic violence treatment, is typically 52 sessions of once a week sessions. There's also parenting classes. There's co-parenting classes. And then there's people who call in that they're dealing with some child custody issues. There could be people that got a DUI or got busted for some other sort of offense, and their attorney's recommending that they come to treatment. So the administrative offices, when they initially get that call, one of the primary questions they want to ask is, are you going to need a progress report or a letter of enrollment, and or are you mandated to treatment? If the person indicates that they are mandated to treatment, then you want to find out what is the mandating body, and you want to get all the paperwork that they have from that mandating body, whether it's a minute order or paperwork from the Department of Children and Family Services or the family court, or they might not have paperwork per se, and they said their attorney told them to come. And so the front desk or the administrative parts, or if you're in your private practice, then you potentially would be handling the administrative and the clinical aspects. Like I said, you want to make sure you have as much paperwork as possible that lets you know the parties that are mandating this, because you're going to want to get a release of information to be able to communicate with those parties. That could be a probation officer, a parole agent, a social worker, caseworker, or it could be an attorney. In certain types of cases, say in batterers treatment, it's mandated in the state of California that you make victim contacts. So one of the important things from the very beginning is determining whether or not the person's going to need a letter of enrollment, progress reports, and or it's some sort of a mandate, or they're doing it for purposes of the court or an attorney. And that's when you're going to want that paperwork, and you're going to want a release of information so you can communicate with the parties involved. So that might be the attorney of record. And like I said, it might be a probation officer, a parole agent, federal supervisor, or directly the court. Sometimes if you're doing a case that involves child custody, you want to get that paperwork because one parent might be bringing in a minor, but the way that the custody arrangement is that both parents have legal custody. And it could be stipulated that both parents would have to agree that the minor is in therapy. So you'd want to make contact with that other parent. So you'd need a release of information. Remember, as mental health professionals, confidentiality is a critical component, and we can never either admit or deny whether someone is or is not a client without having permission to do so. And it's best to have that permission in writing. When someone's coming to treatment, initially they'll want that letter of enrollment. And then typically every 3 months, and it varies, they're going to want a progress report. It's best to request that they give you at least 2 weeks notice, especially if you're dealing with pre-licensed therapists, because they're going to be writing that report and they're going to having their clinical supervisor review it, potentially edit it, and have to sign off on it. So I've had people call me Sunday night, hey dude, I'm going to court tomorrow morning. I need a progress report. Well, that's unfortunate because usually you don't have access to the records. It's a little late. So we want to stress we need ample notice to be able to get that information together. My personal bias is that in those reports, there should be minimal disclosure. The courts and the Department of Children and Family Services are typically trusting the program or the therapist to do the treatment. And so in the progress report, they don't need a tremendous amount of information about the clinical details. But once again, every situation is different. Typically, the letter of enrollment is going to state the date that they enrolled in treatment and indicate what that mandate is. When they have a progress report, it's very important that progress report, after it's reviewed by the clinical supervisor and signed off on, it's okay to give the client a copy, but it's also critical to send a copy to the mandating body. And that's another reason we need a release of information. And that should be best done in a PDF format to reduce the probability that a client is going to add their own stuff in and talk about what a great person they are and how they're doing excellent and all that kind of stuff. In general, we're usually limiting the information of the report to, their punctuality, their attendance, their attitude, their participation. Sometimes it might have their diagnosis. It might even have their prognosis. And that's going to vary from case to case, situation to situation. The reason why this is important is because sometimes you'll be treating somebody and a month into treatment, they'll be like, hey, I need a progress report. And you'll be like, well, you never said anything about this being mandated or you being involved in a legal case or having DCFS or the family court involved. And they might lie and say, no, it's just for me, Well, we're not going to provide a progress report necessarily just for the person. Now, clients or patients do have a right to their medical record. So ultimately, if they do want to have a synopsis of their treatment, that's something that can be provided for clients that are not court involved. And even if they end up wanting their entire medical record, they have the right to that. And there's certain time frames, like 5 days for this, 10 days for this, 15 days for this. I don't have it all in my mind right now, the cutoff dates, but that could all be found from the Board of Behavioral Sciences or the California Association of Marriage and Family Therapists. The laws are dictated to by the state, the welfare and institution codes, business and profession codes, the body that oversees the therapist. Master's level therapists in California are under the Board of Behavioral Sciences, where licensed psychologists are under the Board of Psychology in California. So in terms of the ethical standards, those can be found typically by the association that's connected with your profession. So the California Association of Marriage and Family Therapists oversee marriage and family therapists, and you can always consult with them. And if there's something in question, but it's best to first go to your clinical supervisor, but it's always good to get backup. If you're training to become a licensed professional clinical counselor, I think the American Counseling Association, and also there's an association called KCREP, and that's information you should know. The thing is that when you're a psychotherapist, whether you're a practicum student therapist trainee, a registered associate therapist, an independently licensed therapist, a clinical supervisor, or even an administrator working in the mental health profession, it's your responsibility to know the legal and ethical standards of that profession, and you will be held accountable if something violates that, and there's no excuse of I didn't know. So it's really important for everybody to familiarize themselves with the legal and ethical standards. That's one of the reasons why when you're going to become a master's level therapist, professional clinical counselor, licensed marriage family therapist, or even clinical social worker, the first year of becoming a registered associate, they want you to take the legal and ethical exam. You don't have to pass it, but it's so critical, the legal and ethical issues of the profession of being a psychotherapist or a licensed psychologist. It's so critical because the main thing is we want to do no harm. Of course, we want to help people. We want to help people and help them have a self-discovery and help them overcome their issues, whether it's anxiety, depression, relationship issues, addiction. There's a lot of different things that could be part of it, and they might be involved with other agencies too. They might be having substance abuse treatment on an intensive outpatient, but still have you as a therapist. And in that case, it would be a good idea to get a release of information to be able to speak to the program that they're going to. So that's one of the reasons it's really important to know this stuff up front, because if you find out down the line, they might say, no, I don't want to provide a release of information. And they have that right, but then we're not going to release a progress report. So it's much easier and much better if from the very beginning, we get all the information that's necessary. We get that release of information of the parties that are necessary. Then we're going to be able to provide progress reports when the client needs it. If you guys have questions, comments, thoughts, suggestions, please feel free to put those in. If this is the agency that I'm a clinical supervisor at and primarily making this video for that agency, you can contact me, or you can contact the program director if in doubt or anything's in question. I want to thank you guys for taking the time to watch this. I really hope that I covered all the issues, but I just really want to thank you guys for taking the time to watch this. I hope it was helpful. I know that at the agency in question that I'm doing this for, they really try to not give brand new practicum student therapist trainees cases that involve the court or some sort of mandate, because there's a level of complexity, there's a level of seriousness, and there's a level of liability that is a tad bit higher, and it can be confusing if you don't have years of experience doing this. And so that's one of the reasons why I wanted to do this video. And that's another reason why the agency that I'm working for, the one that I'm making this video for, they're going to try to not give the brand new practicum student therapist trainees cases that have a mandate to where you'll need to be writing a progress report. But after you've been there for a little while and that the steepness of the learning curve has leveled off a little bit, it's possible that you will, because it's a very common thing where people are coming to treatment based on some sort of mandate or recommendation where they will need a letter of enrollment and a progress report. So once again, I hope that information was helpful. I hope I didn't leave anything else out, and I hope you guys have a great day. Thank you.